Hello, and welcome to Funny Turns and No Laughing Matter, a video presentation designed to explain some of the potential underlying causes of syncope, or more commonly known as blackouts or fainting. My name is Dr. Pavia, and I'm a heart rhythm specialist at Heart Care Partners. We have a dedicated cardiac clinic at Brisbane Wesley Private Hospital. My specialty relates to helping patients with often debilitating conditions such as this recurrent blackout, or as we call it, syncope. Syncope can be difficult to attribute to a specific medical cause and can range from minor to serious in nature, sometimes fatal. As such, anyone who experiences blackouts or fainting or some type of funny turn should take these symptoms extremely seriously and consult their general practitioner to discuss diagnosis and possibly treatment. Syncope, fainting, blacking out is basically a loss of consciousness when the blood pressure drops and restricts oxygen to the brain. Most often, a fainting spell is brief and consciousness is regained in a few minutes. Some causes of fainting are harmless, such as vasovagal syncope, which is a simple faint caused by a sudden drop in blood pressure and stoppage of blood to the brain. Then things resume. But there are far more sinister causes of syncope, with heart rhythm disturbances or cardiac vessel problems, or neurological conditions such as stroke and epilepsy. The first test, and the most important, is a thorough clinical examination. So the doctor should check your pulse, your blood pressure, lying and standing, listen to your heart, and if you have any weaknesses, check your central nervous system. The next important test is an ECG, which is a non-invasive test used to determine any abnormalities of your heart rhythm. If there are no abnormalities on the ECG, the next test we like to do is an ultrasound to make sure your heart muscle is normal. If you experience palpitations during or after a blackout, it's very important to tell your doctor, and we can then arrange a monitor for 24 hours to continuously monitor your heart speed. In cases where the palpitations or the syncopal episodes aren't very frequent, your doctor might suggest another way, and that's a long-term implanted monitor under the skin, and we call this a loop recorder. This is a little device which can monitor your heart rhythm for long periods of time that's placed under the skin with anaesthetic. It can stay in place for up to 3 years, and if you have any symptoms at all, this device can send information to your doctor, and a technician can pass on the information as to whether your heart was the reason for your blackout. For patients where the symptoms warrant more invasive, comprehensive cardiac testing, a procedure called an electrophysiological study can be considered. And this procedure involves the use of electrodes which run from the groin up to the heart. The electrodes measure the heart's electrical wiring system and assess whether your heart rhythms are too fast or too slow. Other important tests, such as blood tests to check your iron and electrolyte levels, can be performed. And if there are any neurological problems such as muscle weakness or a seizure associated with the blackout, we may arrange brain imaging such as MRI or CT scan. The majority of syncopal episodes are, however, simple faints, and this will have no bearing on your prognosis in the future. The more serious types of syncope, where there's a cardiac rhythm problem, further therapy is indicated. So if your doctor has identified that you have a very slow pulse, sometimes called heart block, where you have wiring systems in your heart that are not firing synchronously, or if your heart stops for a period of time, we might offer a pacemaker. And fitting a pacemaker is a relatively simple and straightforward procedure. These devices, generators, have a battery and can last up to 10 years and are attached to the heart with leads. Other important conditions that are heart causes of syncope are ventricular arrhythmias, which are fast rhythms, and these can be fatal. And just like a pacemaker, a defibrillator can be placed under the skin and attached to your heart to protect you from these potential fatal outcomes. Medications are really important to stabilise wiring abnormalities. Low blood pressure and blood count play an important role in guarding against syncope and funny turns. So blood pressure medications may need to be adjusted to keep those levels in check. Syncope is more often than not a minor issue which simple lifestyle and behaviour modifications can deal with. That said, funny turns are indeed no laughing matter, so if you have questions or concerns, please take them seriously, because sometimes losses of consciousness can be far more sinister. Heart Care Partners Syncope Clinic is based at the Wesley Hospital and is taking patients now for assessment. Thank you.